Hi, I'm Narelle Mills and I'm the CEO of the Australian Dental Council. I'm currently studying the Master of Health Policy at the University of Sydney. I'm joined here by my lecturer, Dr Carmen Huckel-Schneider. She's going to help answer some of the frequently asked questions about the program.
Thanks for joining us, Narelle. It's great to be chatting with you. Hello, I am Carmen Huckel-Schneider. I'm a senior lecturer in the School of Public Health, and I'm also the program director of the Master of Health Policy, as well as the deputy director at the Menzies Centre for Health Policy. And the Master of Health Policy at the University of Sydney is run out of that centre with myself and the other staff members who are all researchers in health policy who also teach our course. It's really great to be chatting with you, Narelle. So,
Carmen.
Questions to work through. So why did you choose to study health policy?
So I've been working in health practitioner education on assessments and regulation for almost 20 years. And so what I realised is I had a bit of a gap in my professional knowledge around how to interpret health policy. I get a lot of health policy that crosses my desk that I wanted to have some frameworks or some more rigour around being able to assess whether it was, good quality, whether there were gaps. Also looking at evidence and being able to discern really good evidence for policy. So I just wanted to, sharpen up my skills around that and, apply that in the Australian and international context.
And why did you choose the University of Sydney?
So I was looking around for a master's that was actually not epidemiologically based because I have a background in, I've got a Bachelor of Arts majoring in anthropology and philosophy, so very unrelated to a science background. And so public health was probably not what I wanted to pursue. And the University of Sydney has the Master of Health Policy that is mostly targeted to people with my professional background that doesn't necessarily suppose or presume that you've got some of that science or epidemiology background, but does tailor the content to be around management roles and leadership roles in, forming health policy or at least influencing health policy makers. And so that was why it appealed to me. I've got a friend who has done this course as well, and she recommended it to me. She's got a very similar professional background to me. It was attractive to me because it's online. I'm based in Melbourne. And so majority of the units that I've done so far have been online. So that really suited my learning style around the flexibility, but also gave me the content that I needed for my professional career. It's also very attracted to the fact that it was the University of Sydney and, as you said in the intro, the Menzies Centre for Health Policy and the quality of the teaching and the people that are actually active in creating and developing health policy. So, it sort of was the perfect fit.
That's great. So how far are you in your course now?
Probably about halfway. So at the end of last year, I completed probably all of the requirements for the graduate certificate. And as soon as I was eligible, I quickly re-enrolled or transferred my units into the full Master of Health Policy. I actually didn't qualify for the Master of Health Policy to start with because of my Bachelor of Arts background. And so I did just enroll in the grad cert at the beginning, which actually suited me because it gave me a bit of a foray into structured learning again. I hadn't done any formalised learning for more than 20 years. And so I was sort of very happy that it was going to ease me back into how, learning was taking place now. And so I loved it so much. Last year was fantastic. And so as soon as I finished all of the units at the end of last year, I quickly transferred to continue to, achieve the Masters, hopefully by the end of this year or early next year.
Yeah, that's right. And it is, of course, possible to do it part-time. And you're obviously very, very busy. You are a CEO, you work full-time. How are you managing the study along with your full-time work?
Look, it's a challenge, and it was probably one of the sort of limiting factors why I didn't do this sooner. I also have a young family, so a full-time CEO job, but also a very young family. So that was also a consideration, but I think I made it a priority. It's actually very related to my job. So I've actually been able to do quite a lot of the study, and the assignments, etc., are very, very relatable to my work. So I have, in some instances, done sort of two birds with one stone, that, you know, an assignment has become something that I've used in work anyway, which is kind of what you want in a further education or postgraduate course like this, that it's applicable to your you know, professional development. And so my organisation is supporting me to do this as well. So I did negotiate some dedicated study time, etc., with them. But the readings have been really interesting. So I haven't actually found it a chore to do that. So it's just been prioritised, organised, all of the buzzwords around how you just get things done.
That's great for us to hear as well. So how much of the course is online compared to face-to-face in the way that you're working through the Masters?
So I've done the majority of it online. There are a couple of units that I've done in block mode or on campus. So I have gone up to Sydney. As I said, I'm based in Melbourne, so I have flown to Sydney and spent, you know, 5 days on campus to do some of those. And I enjoy both modes. I'm quite a social person, so I really did enjoy the one unit that I did do on campus last year. It was fantastic, and I made some really good contacts in terms of the other learners. It was a very small group. It was only 8 students, and very diverse background of some health practitioners, and then some policymakers, some people that worked in regulation government like myself, and then the quality of the, you know, that interaction with the lecturers and the program, the unit leaders, was sensational. So that was really good, but also the online learning and the flexibility around, you know, there's certain milestones and tasks each week that we have to hit, which is great because it means you have to do it, you have to contribute, and you have to forces you to do the learning, but it's also at your own pace. So I've really enjoyed the combination of that, and there are some things that are sort of expected to be done in a face-to-face way, because that's the best way to learn, and I think that's what the university is sort of balancing around, you know, what delivery mode is best for the content that's being learnt and the learning outcomes.
So do you find it easy to reach out to your lecturers and the other academics at the Menzies Centre as you're moving through this course?
Yeah, look, I'll admit I thought, oh wow, how's it going to be doing a master's completely online and from Melbourne, etc. But I haven't found it difficult at all. Everyone's really responsive. Everyone's got really good ideas or feedback or suggestions. It's a nice balance between they're not going to tell you the answer, give you the clues, and just even with being an online student, just a really great community around, you know, being part of the larger faculty of medicine as well. So it feels like a community and really accessible.
So how has the course lived up to your expectations so far, Narelle?
I think I really very quickly started applying what I was learning, even, you know, in the first semester of last year to my work. You know, I've got sort of on the job experience around this. It's, you know, over 20 years, you kind of, you know, just learn it from what's worked in the past, etc. But I started to apply a little bit more of the rigor and the structure around my thinking. It's become a bit more second nature. So when I read something now, I'm like looking for the actor influence or the, you know, the structure, the way someone's pitched a policy, but also how I'm writing papers. Even for writing papers to my board, I'm more broadly considering how the people around the table are going to receive this. Some of those people are health practitioners, some of them aren't. So it's been immediate benefits from myself and my confidence in what I think. I don't think I would have got to a different answer. I would have probably been similar in what I was sort of supporting or not supporting. But I think it's just given me the confidence that I've got the backing and the knowledge and the evidence behind why I'm making those decisions. So immediate benefits from me.
That's great. So I've got one last question for you. What have you found to be the most valuable component of the program?
I think there's some tangible and intangible outcomes. So the tangible outcomes for me have been sort of the frameworks and the I guess legitimizing my decision making, etc. So if I'm ever challenged at that respect, I can say, well, this is why it's going this direction, or this is why I'm not supportive of this. And also I do a lot of responses to government consultations and things like that. We're asked for comment a lot. So when we respond, I can also, you know, provide that rigor around, well, this is why we're saying this. but also just that intangible stuff. As I was saying before, you know, it's become a little bit second nature now that I'm thinking more holistic around the influences, the positions of the different people that may be trying to influence my organisation, but also how I'm influencing others. And so that's become a bit more second nature, and being able to, not having a science background, being able to look at evidence in support of policy and actually sort of drive the proverbial truck through it and see where the gaps are and why they might be sort of bamboozling us a little bit with nice pictures and graphics, but actually what is the evidence really saying, and is this selective evidence, and what does, you know, where, what else have they missed in the policy, etc. So that's been, you know, really great for me.
That's fantastic to hear.
So I've got lots of questions for you too, Carmen.
Okay, I'm in the hot seat now. Thanks.
Do you need to have a health background to study the Master of Health Policy?
So the Master of Health Policy is an accelerated master's program. So whereas normally if you were doing a postgraduate master's, you would need to study for 18 months full-time equivalent or equivalent part-time. This is a master's that can be completed in 12 months full-time or equivalent. And that means that in order to gain entry into the master's, you do already need to have career experience, work experience behind you. It doesn't necessarily have to be in health, although we do have lots of students and encourage students that have a health background, whether it be clinical background or specific health policy background or health planning background. But it can also be any other kind of policy-oriented career. That can be in the public service, that can be in consumer organisations, professional associations. It can be in sectors that are broadly related to social well-being of the population. That can be education, that can be in social care, that can be in town planning. And we also have people that come through from professional private sector careers, usually generally broadly related to the health sector. That could be anything to do from manufacturing and import to research or to logistics. So you do need to have that career backing behind you, some work experience, effectively to be able to qualify for this accelerated program, but it doesn't necessarily have to be a health background, no.
And is there value in the graduate certificate or the diploma of health policy?
So there certainly is. So not everyone can commit immediately to a full master's, and a graduate certificate and a graduate diploma will get you that really good foundational understanding of fundamental frameworks to use in health policy decision making, fundamentals of health economics and how it's used in decision making. And it will start to really get you those that grounding in what we call big picture thinking, or critical appraisal, as well as systems thinking. So these are, you know, the key concepts that we really develop throughout the whole program. And you will come out of a graduate certificate and a graduate diploma with skills in that systems thinking and being a big picture thinker, as well as having frameworks to use. The other really useful thing with a graduate certificate and graduate diploma is if you don't meet all of the educational requirements for entry into the program, so normally you would require to have an honours degree or equivalent, and we look for a credit average at that. If you haven't achieved that, you can enter into a graduate certificate or a graduate diploma in the first instance. And if you are able to achieve a credit average, you're then able to upgrade to the master's. So it's also a good entryway for those that don't meet the full requirements right at the start.
No, that was my situation. Yeah. And so what's the difference between a Master of Public Health and the Master of Health Policy?
So that is a really good question. It's one that we do get a lot. So obviously a Master of Public Health is, first of all, it's an 18-month degree, and it's something that you can enter straight from an undergraduate degree. And it is developing core skills in what we call public health. So that's looking at health prevention, it's looking at disease tracking. You do courses in epidemiology and some statistics, as well as health promotion. Master of Health Policy is aimed more at that strategic and decision-making level. It's an accelerated degree, and it looks beyond what we would call typical public health aspects of the health system to go into health systems more broadly. So in a Master of Public Health, you get to know how the health system functions, the curative, as well as the management, as well as the preventative, as well as the public health, how the health system is financed. And in the Master of Health Policy, you're looking more broadly at how policy making functions and how decisions are made, and how we can become good managers and good leaders throughout the health system, whether it be in the public health part of the health system, whether it be in the social care part of the health system, whether it be in advocacy, or whether it be in actually managing how decisions are made about how we finance health professions, how we finance, how hospitals are run. So it goes beyond the public health part of what we call health to take that broader big picture view right across the whole of the system and beyond.
Can you undertake the Master of Health Policy completely online?
So up until now, we've always had one unit of study that we have required people to come in to do face-to-face. Apart from that, all of the other units of study have been online. From next year, so actually for anyone who starts from semester 2 in 2020 and beyond, it will be available fully online. However, we really do encourage all of our students to take at least a couple of the units in what we call block mode. And block mode is where we have compacted sets of learning over 2 days, usually a Friday and a Saturday here in Sydney, where the whole class can come together and we can practice core skills such as speaking and oral presentations and group work. So all of our units are available online as well as in that block mode. So anyone who enrolls will be able to choose whether they want to do the block mode version of the unit or the fully online version of the unit. And for international students, of course, if they come in with a visa that has a requirement for a certain amount of face-to-face learning, we offer all of that for international students as well. So international students that come into Australia on a visa, if you have that face-to-face requirement to maintain your visa, you can enrol in the block mode versions of all your units of study and you'll meet those requirements. And we really enjoy having those international students in those face-to-face classes.
And what practical skills can students expect to take from the program?
So what we really want our students to graduate with is to be the person who's confident sitting in the room of people with multiple backgrounds, multiple different sectors, and be the person that brings everything together in that big picture thinking. So a lot of people come into the degree program with a certain career background where they specialise in a particular type of discipline and a particular type of thinking. So they might be a social scientist, they might be a clinician, they might be a manager, they might have a background in social planning, and they are very concentrated on their particular discipline, often related to what you've done in an undergraduate degree. When you come into the Master of Health Policy, you exit and graduate as the person who's very comfortable having a statistician at the table, an epidemiologist at the table, having a consumer representative at the table, having private sector representative at the table, having someone who manages hospitals at the table, having someone who's a politician or a politician's advisor at the table. And you can talk to all of those different people and bringing together all of those different perspectives and be the person who guides and makes wise decisions. So it's bringing your skills up to that next level where you're the sort of person that brings it all together. And we teach various different skills and have various different frameworks that we work through to make that kind of decision making and policy formation and problem solving easier, considering all of those different perspectives. So you work through how to do a stakeholder analysis, you work through how to write policy briefs, you work through and develop skills on critically appraising other policies as well as evidence for that policy. You develop skills on understanding the different stages of policy making and working out where you're at and what's needed at the time. You develop skills in how to think beyond the current problem into flow-on effects and feedback loops throughout whole systems. You also develop skills in who are the different players on the global level, national level and sub-national level that you need to consider when you're making decisions in health policy. And of course, you develop those skills in being able to formulate arguments, put forward new ideas, and always work with conviction and integrity in all of the work that you do in your everyday life. So we find that students come out that's so much more confident in being able to take that big picture view of all of the different policy problems that will never go away and will keep on coming towards us as we move through the next years and decades and everyone's future careers.
And who would benefit from this course?
So anyone who's really wanting to move into that next step in their career, so if you're already in a place that you're working in health policy or something health policy related, and you're finding that you either want to or you're being pushed into those kind of roles where you're going to have to take that next level strategic thinking. It could be that you're also someone who is identifying in your career so far that there are certain problems that you're unable to solve without taking a policy or a bigger picture perspective. We have a lot of students come in and say, you know, I've been working in my career for 15 years now and I know that things have to change, but I just can't make them change, or they're just not changing. And you want to be someone who affects change and puts forward new ideas and makes them work. That's a really good reason to study a Master of Health Policy as well. And of course, there's also students that are looking for a change in their career. So you may have already had quite a lot of experience in one particular sector, but you're finding that it's a time for a change, whether you're in the public service and you're moving into the health area, or whether you are finding that you are now, because of a personal experience, you want to be able to advocate for change around health, then it's a good way to move into health if you've already had some experience in some other kind of sector as well. So for either a career shift or often a career up or a career progression, all good reasons to study a Master of Health Policy.
What about international students? Can they benefit from this program?
Yes, most certainly. I am always incredibly impressed with the cohort of international students that we have coming through the program each year. I guide them through often a lot more closely than I do the domestic students, a lot more conversations. Usually when you come to study in Australia and the Master of Health Policy is included in that, you might have to adjust to a very different way of thinking and learning. And a Master of Health Policy, you can sometimes find that at the start, it really blows out your traditional way of thinking. It really is about becoming comfortable with the complexity of systems and problems, not shying away from understanding that different people have different ideas and different interests, and the challenges of bringing them all together in our problem solving. So we encourage international students to come and apply for the program. We have a great team at the Menzies Centre for Health Policy that will work with you so that you will also graduate being one of those big picture thinkers who can have all of those different types of people around the table when you go back into your country, and you're the one that is comfortable bringing that all together and solving problems.
And what are the career opportunities that exist in health policy?
So there are so many different places to work when you graduate from a Master of Health Policy, and a lot of our students find that they get either a promotion or apply for a higher level position after completing the Masters. So the obvious place that people go and work, or the obvious role that people work in after a Master of Health Policy, is as a policy analyst or a senior policy analyst. And that can be in a range of different types of organisations. So in Australia, in the public service, the departments and ministries of health is an obvious one. But there are also the professional associations out there that also require policy analysts, consumer organisations, disease-specific interest groups such as Diabetes Australia and Cancer Australia also require policy analysts. We also have people that work in strong advocacy roles. We also have a lot of graduates that work then in advisory roles. So that might be for a politician or for a particular strategic department or section in government, either in Australia or overseas. Of course, there are also international organisations that require policy analysts. And it is a key skill that people are looking for, is that someone who can take that big picture view, someone who can be a systems thinker, someone who knows how to work with both the evidence as well as the stakeholders and the interests, and someone who is comfortable with the messiness and the complexity of everything that needs to go into developing new ideas, making them work, and actually making strategic decisions. So there are a lot of different places where you can work as a graduate of the Master of Health Policy.